orbitofrontal cortex. We said the orbitofrontal cortex is the part of the brain that regulate your emotion, impure the intellectual materials. Impure is mean like marinate. So when you say I love you to somebody, it will show up in your affect and your feeling and your tone. So you don't say I love you, or you say I really love you. This tone is really where coming from the orbitofrontal cortex. Any damage to the orbitofrontal cortex will make people impulsive, distractible, and mood liability. So whether it's head injury or lack of parenting as a child, the same result. They become very impulsive, and they might be subject to addiction. They are easily addict in the future. And usually it's a mother relation that make the orbitofrontal cortex function well. So it depends on how much you bond with your mother. It's a win-win situation for the daughter and the mother when they have this. So any disturb in the attachment or head injury will affect that orbitofrontal cortex, making you very impulsive and very agitated. It also make you recognize other people's feelings. So we did not have a lectures on ADHD this year, but orbitofrontal cortex is a part of the brain that make you connect with other people. So, for example, when you see somebody and you see somebody who is sad or anxious, you can realize it. The orbitofrontal cortex will make you read other people's feelings. So one of the problem with borderline patient, they cannot read your face, so they cannot predict how you're gonna react. So they become defensive because they cannot read your facial expression, your facial feeling. Why? Because they did not bond with their mother. They did not learn it from their mother when they were infant. That is the problem with their, bonding issues. If you bond with your mother as a child, you will realize that the mother's facial expression will stick in your brain when she is happy or sad. You can read it easily. But if you have disturbance and bonding, then you're not going to be able to read your mother's facial expression. Remember, the mother is the first object relation. So if you could not read her face and bond with her, you're not going to be able to bond with other people or read other people's feeling and face later on in life. And orbitofrontal cortex is not only impaired in borderline, but also the bipolar disorder, ADHD, traumatic brain injury, dementia, meningioma. There is a lot of illness where it can damage the orbitofrontal cortex and cause it to be very hypoactive. So hypoactivity in orbitofrontal cortex make you impulsive. Disinhibition, like when you drink alcohol, you remove that orbitofrontal cortex from the spectrum and you become disinhibited. So as we said, they have a lot of inability to control that emotion. So if you remember Samiha from the first lectures, where Samiha, when she had the fight with her husband, that color stick in her mind. So here is the memory of the trauma which happened as a child. We said, we said that the amygdala is the key part in emotional regulation, and most patients with borderline have very hyperactive amygdala. So the amygdala kind of control the frontal lobe instead of the frontal lobe controlling the amygdala. So this toy is here, the frontal lobe, and the small toy is the amygdala. So here in borderline is the opposite. The amygdala is the one in control, and the amygdala, when it's in control, is always put you in defensive place, make you very tense, make you very emotional, and it always put you on alert so you can fight that danger. Because remember, the amygdala's role is to protect you, and the amygdala and borderline always on the defensive, always alert, because they never had a soothing feeling, because they always in the war. They feel always like they are in dangerous situation. So their amygdala is in control. The PFC, the babysitter, is not able to control the amygdala, and they become always, they look at life in a very threatening and very stressful environment. The other problem we said in borderline is mentalization. So mentalization is the ability to understand other people's mind and feeling. And we said because they did not bond with their mother, borderline patient cannot understand other people's feeling, cannot convey the feeling of others and recognize it on their own. So borderline personality is have a lot of fear because they are unable to predict what's going to happen in the future in their loved one, or if you say anything, they might feel like you're gonna threaten to leave them. And the worst thing for borderline is being abandoned by anyone. These borderline will not be able to recognize the feeling of these facial expression. They cannot interrupt facial expression of other people, so they look at everybody like wearing kamama now. So if you wear the mask, you cannot, a lot of, I see a lot of my friend in the hospital, but I don't know them because sometimes when they put the mask, I don't know them. So it's like borderline. Borderline cannot read anybody's face because they look at everyone like wearing a mask. So they cannot read their facial expression. They cannot read their ability to understand them, whether they are happy or not. So they feel threatened because they feel everybody is against them in that way. So what they have is what we call emotional dysregulation or affect dysregulation, where they always have a very stormy relation, very intense physiological reaction. They can explode anytime. If you see a word, they become angry all the time, and they are unpredictable. They are self-harming. They have high-risk behavior, like they commit suicide all the time, or try to commit suicide all the time. They have chronic suicidality all the time. They are chronically suicidal in that regard. And they are always run by the limbic brain. Limbic brain is the one that running the show on these patients, not the cortex. So what pushed their button? How, most borderline would be fine for a long time, but they can, what you call it, flare up or have a feeling of anger, and they have what we call borderline storm or anger storm when you threaten to leave them. So any threatened attachment problem, they can be angry and trigger that button, or feel they are misunderstood. So if you misunderstand them, they become angry. They cannot read your emotion. So remember, you cannot soothe them because they cannot read that emotion of yours. So you always have to walk with them on eggshell all the time. Why they do self-harm, as we said, because it's increased the opiate receptor in the brain. So it will be self-soothing for them. It's like taking a shot of morphine. When they cut on their arm, it's like taking a shot of morphine where you feel relaxed and happy. And we have always to find a way to prevent suicide and try to teach them ways to cope and soothe themselves without being hurt and without killing themselves. So in crisis, we have always, when you see a borderline patient, if you decide to take her into your clinic, then you have to always develop a crisis response. And you have to do boundary violations. So a crisis response, that you give them a number to call, tell them to call when they are suicidal, give them medication very judicially in a way that it will not make them abuse them, always assess the risk of suicide, always make a safety plan, always make liaison with the stakeholders who talk to her mother and father all the time. They have to be in control. Don't over involve with the patient, because the patient's borderline, they might invade on your boundary. So you have to be clear, like you can come to the clinic at this time only, and you can have this question, and you have to do rules for them, because immediately if you bend the rule, they will bend it completely. So you cannot tell her, if she tell you, I can visit you at home, or let's go for a walk, you don't do that. I remember one of my student, I was his professor at the university back in America, and he was a fourth year resident in psychiatry. So he was about 2 months from finishing residency and being board certified in psychiatry, just a few months short of that. And apparently, one of the borderline patient asked him, she told him that, the clinic is very busy and crowded. Can we go for a walk in the park and let me explain to you my problems? So poor guy, he went with her to the park, and after that, she had a crisis and she accused him of doing something, and he was his license, all of his medical school taken away from him, and he is selling, hamburger at McDonald's. No, I'm just kidding. I don't know where he is now, but they took away all of his license because of that. So you cannot do anything with the borderline. You cannot visit them at home. They cannot visit you at home. They cannot drive with you. They cannot do anything. You have to be very strict in the boundary when you deal with borderline. A treatment with medication might work, so you give them an antidepressant, might be a good idea, because the amygdala, remember, is very hyper, and SSRIs tend to tone down the amygdala. They have two new things that might help. Oxytocin, they are developing now. It's still in the trial. Oxytocin. Most borderline don't have any oxytocin in their blood, or their oxytocin is low. Remember, oxytocin you get when you have like somebody who love you, and somebody who care about you, somebody who send you flower and say good things to you. So this is where increased oxytocin. Borderline had very, very low oxytocin. The guy who used to study oxytocin is named Mike George. And Mike George used to go measure oxytocin in patient. The problem with oxytocin, it has very short half-life. So you have, like, he take the machine with him on the spot. He go to a wedding. The wedding is where most people have very high oxytocin. So he will take the blood from people in the wedding and measure the oxytocin in their blood. And he found out that oxytocin will be very high in the bride, in the wife to be. So she will have the highest oxytocin. But the second highest is not in the husband, it's in the mother of the wife, who had very high oxytocin also. The husband does not have any oxytocin apparently for some reason. We don't have a lot of feeling. I'm just kidding. Okay, so flexible limit setting, you have to be very, very careful in dealing with them. Boundary violation is an issue because they will immediately violate the boundaries. We have to be very black and white with them, no's and yes, and what is permissible and what is not. Um, the best treatment for borderline, this always come in the exam, in every exam, is called dialectical behavioral therapy. It's done by Marsha Lanahan in Washington. This is Marsha Lanahan is the mother of borderline. She teaches patient how to deal with the stress, to deal with impulsiveness, to deal with mood liability, and teach her like what her mother did not teach her, how to regulate the emotion and how to be able to deal with behavior and relation and self-image. So if you want to read about it, it's very good. There's a lot of book you can read about it. Just put the name Marsha Lanahan. There's a book, I want you to read it in the summer. This is book, you will never regret reading this book. I have it, but you can order it from Amazon. It's one of they let every psychiatry and every physician read it during residency. It's called Love Executioner. It's about a story of a physician who fall in love with the borderline patient, and how much that love had damaged the physician and the lady. And that's why we are really in psychiatry. You cannot make any relation. You cannot even marry one of your patient. And if you want to marry, don't marry a borderline. It's very hard to deal with them. So it's called Love Executioner. So don't read it now. Order it in the summer and read it, and you will really enjoy reading that book. Now we'll move to the other personality, which is called narcissistic personality disorder, which is, very common. للأسف, not as common as borderline, but the problem is you need to be aware of it, because you can really tackle the early sign of narcissism. So if you have a husband or a wife or a friend who is narcissistic, you need to get him treatment quickly, because he will make your life miserable. So the main issues with narcissistic is because they are unrealistic, inflate self-esteem, self-importance. So they are very, very important, with lack of sensitivity to the other. So there's two things in narcissism. One is I feel great, I am the best one in the world. Second, I don't care about other people's feeling. So this is the main issues with borderline. So one of my patients named Verona, and she was a kid who were spoiled by her parent. Then she lost her mother, but her father really spoiled her way too much. And she used to come to the clinic wearing very, very provocative clothes. So we would always tell her to put something on before she entered the clinic. And one time she was upset with her husband because she was having an affair and he is upset and she doesn't want him to be upset. She said he has no right to be upset. So this is how narcissism feel. They don't care about other people's feeling. They can do whatever they want, but they cannot let the other one. They will not permit the other one to be mad at what they did. She had no insight or no ability to understand why he is mad. So this is typical of narcissism. It came from the Greek word narcissus, the guy who fell in love with his picture on the water. Although I feel he is very ugly, and I don't know how he fell in love with these ugly pictures. But anyway, it also comes from the narcissistic flower, Zahrat al-Nargis in Arabic. Nargis in Arabic, flower that is called daffodil in English, daffodil flower in English. In Arabic, we call it Nargis. They call it Nargis, Zahrat al-Nargis, or daffodil flower, because this rose or this flower will grow and will not let any flowers grow around her. So it will be only in the field. It will not let any flowers grow near her, near that flower. It always comes from childhood, either neglected or spoiled childhood, and also the genes. So there is a lot of factors here. They claim, it's very hard to deal to understand this, but there's a place in the brain where we have empathy. Is one of them, orbit frontal cortex accumbens, periaqueductal agree. All of these part of the brain has to do with compassion and empathy. So apparently these patients have poor activities in this area of the brain. So is it a brain disorder? We don't know, but it's psychological and brain disorder. So definitely there is some problem in the brain here. Uh, they have exaggerated sense of achievement. So when I did the research, it is the best research in the world. When I do lectures, it's the only lecture that the student understand. I am the only one who anybody can understand. I am the best teacher in the world, preoccupied with fantasy and success. So I was the most successful person in the world. If I love somebody, the love I give you is the best love. Nobody else can even get close to that love I'm giving you. If they say they are brilliant, they are not only brilliant, they are the most brilliant person in the world. They believe they are special and unique, and God created them, and then that's it. He didn't create too many out of them. He is one edition. He is the only edition that God created. They envy others. So if you are successful, they will envy you and try to destroy you because they don't like anybody. It's like the daffodil flower. Nobody else is allowed to be close to them. They require a lot of admiration. So when you sit with a narcissistic patient, you always have to say how great he is and how much his achievement had affected the university and the world, and that his research make a huge difference in the field and all of that. Okay, and we have a phrase in America we call "you are the best thing since sliced bread." So they are always the best thing since sliced bread. So God created them, and it was a special moment when God created them to help humanity in their suffering. So, for example, this is the guy who said, his wife said, "You are wonderful," and he told her, "I know." So this is the way narcissistic feel. Great respect. Boundary is always, they will not respect your boundary, so you have to be slave for them all the time. And they always accusing you if they make any mistake, it is you are the one who did the mistake, not they are, not the one, not are you are the one to blame, not them. And if you argue with them, this is a common thing they always say. I never said that, so they get away from it. You are imagining things, so you might say a bad thing to her, to your wife, and you are narcissistic, and she accuses you of saying that, and you always say you are imagining things, you are crazy, that never happened, that cannot be a joke. So they are always use projection. They will not be able to bear any responsibility. And the problem is I see a lot of women here go in the circle of abuse of narcissistic significant other. So they are missing a lot, or they always blame you for not being happy. So the wife will be blamed for her husband's misery, and she will be blamed that she was never able to make him happy and all of that. They always don't see other. They require things from you without giving you anything. So it's all about me. That is borderline patient. It's all about me. So case study, we have Mr. L, 26 years old, student who suffer from depression and anxiety. They do suffer from depression and anxiety. So he is in psychotherapy, and Mr. L is overachiever, excel in academic. This is all narcissistic. They feel like they are the best things. They always say, I am graduate of Harvard or Oxford or Princeton. They always have to pride on themselves. And they are the best looking man. He said, Mr. L said he was the best looking man in the university, and the most achieving man in the university, and the best achieving student in the university. During the therapy, he bring copy of his CV to the therapist and tell him how good he was in the medical school, where his teacher was unable to be like him because they envy him because he was better than his teacher. Then he goes on, and I'm different than most of my your clients. So he's telling the therapist, I'm not a regular client for you. I'm the best one. You have to spend a lot of time with me and spend a lot of brain cells with me because I am very high talented person. He was always brag about himself, and even he is better in psychology than the therapist because he took a course of psychology in college when he was in Bristol. So he knows everything, and he is giving you a favor by letting you see him. This is how narcissist will see. So he said, like in medical school, uh, his teacher used to envy him because they don't know as much as him. The classmates were way below his standard, so they were not like him. Said, and he said he is like all the teacher will not be able to. The professor will not be able to be as good as him even when he was a student. So this is a typical, narcissistic patient. And the reason why he's alone and doesn't have many friends because all of his friend is not very close to his intellectual activities. So he feels so intelligent, and he cannot sit with them because they cannot be, able to understand him. So they are very selfish, and they don't look at the feeling of other people. So he's telling the therapist that I'm giving you a favor. So just seeing me should be should make you feel of narcissism. We finish today, which is antisocial personality. An antisocial personality is common in prison section. So if you go to prison, you'll see a lot of them. Now, two personalities have no remorse for other: antisocial and narcissism. So both of them, like an antisocial, he will kill somebody and have no remorse, no emotion when they kill somebody. They are aggressive, irritable. They don't feel other people's feeling. They don't look at other people's feeling. They are very deceptive. They are lying. They are subject of arrest. They steal, and they drink a lot of alcohol and drugs, and they, unable to understand that they hurt someone. Like if I see computer on the table, I will steal it and feel like it's my computer and this everything should belong to me. So this is the typical of borderline. I'm sorry, typical of antisocial. Sometimes they call them psychopath or sociopath. The same sociopath, psychopath, and antisocial personality. They are very greedy. They don't have any moral value. They can bend the rule all the time. They can abuse you and never feel hurt. Like they take your right and don't feel anything about it. They break the law all the time. And the main issue is they show no remorse, cannot accept any responsibility. It's not my responsibility. So, and they apparently they have problem in their frontal lobe. Remember, frontal lobe is the part of the brain that make us feel right from wrong, and these patients have very low activities in their frontal lobe. Now, we'll finish here, and I will be happy to answer any of your call. And if you have any question, let me know. Uh, we will not be able to do the sleep lectures now. If you want, we can do it, but it's going to take an hour. If you are willing to stay an hour more, just let me know. If you are not, we can do it later on. Let me answer some of the question. Now, one thing before I finish, I see a question. So don't accuse all of your friend and everybody you know she has this kind of personality or not. You know, take a very, very good physician and very expert physician to diagnose these. You might see some element in some of your relative and friend, but it doesn't mean that they have the personality disorder. So don't rush into diagnosing anyone with personality disorder. So I will suggest that we do it tomorrow or the weekend or any time if you want. So I don't know. Just let me know. Can be charming. Borderline can be charming because when they want something, they become very charming. After they take it from you, they become very ugly. When is the next lectures? I don't know. Let me know. I'm ready. If you want to do it now, we can. But we're not going to be able to do it in 10 or 20 minutes. It's going to take an hour. You want to do it now? Okay. Yes, narcissistic is all the time. They are stably. Two things in narcissism: they don't feel others, so that they don't feel like other have any right, and they everything is belong to them. No, we cannot diagnose personality disorder in children. So if you saw an exam that this is the same symptom of borderline, but he is 17. It's not borderline. You cannot diagnose any personality before age 18. Remember, you cannot diagnose any personality in age until age 18. But the symptom might start from childhood, but it doesn't mean that he is borderline at childhood. You will not do it. You will not be diagnosing until it's 18. Okay, let's do the next lectures uh, about sleep, and if you want, we can, do it later as.
Doctor, can you finish it in 30 minutes? Or is it
No,
going
so
to
I'll
take more?
finish whatever, and then hopefully we'll do it again. Okay.
Okay.
Okay. Let's see share, and then we're gonna share the 1 second. Okay, sleep, and here share. Okay, share. Do you you see it now?
Yes.
Hello? Okay. So today we're going to talk about sleep disorder and hopefully hear me well.
Yes, you're clear. Yes, doctor.
So we're going to talk about sleep disorder. Sleep disorder is very common in psychiatry. This is the most important lectures. Unfortunately, we have to do it the last. This is very, very unfortunate. So sleep is very important and very interesting. We measure sleep by doing what we call EEG, electrophysiology encephalography. It's not awake, but a little bit drowsy. You can is it dropping? Voice is like and consolidation of memory. And you really need to sleep early always because it does not happen if you sleep after Salat al-Fajr. So if you sleep after Salat al-Fajr, most of the sleep is 1 and 2 and REM. Deep sleep or stage 3 sleep happen between 10 and 2 or 3 o'clock at night. So we call it delta sleep, slow wave sleep, deep sleep, restorative sleep. Why they call it restorative? Because the body restore everything back to normal at that time. It's like when you go into a party and you need to clean the house, you clean the house after the people leave. So this is where the brain clean the brain and clean the body after everything happened during the day, so it will prepare you for the next day. So you really need to go to deep sleep. And then we go to REM sleep. REM sleep is the rapid eye movement sleep where we have the dream and the intense dream, and you consolidate memory also in that part of the sleep. So from 1 to REM, back to 1 take usually 90 minutes to 120 minutes. And we have like 3 or 4 of them every night, and that's what you call sleep. And the more we get, the less we get in stage 3. So the first cycle will have plenty of stage 3, next cycle less, third cycle a lot less. So this is the sleep again, stage 1, and then you go to stage 2, stage 3. And you see the more the night goes, the less time you spend in stage 3 and the more time you spend in REM sleep and stage 2 sleep. So the sleep after 4 o'clock is mainly REM and stage 2, not much deep sleep. So deep sleep happen only in the first 3 hours of the night. That's why you need to go to sleep early, because deep sleep or restorative sleep is the most important sleep that you benefit from. This is what you call refresh sleep. Make you refresh in the morning. And consolidation of memory happen in the deep sleep. You're gonna put it in the hippocampus. At 6 o'clock at night tonight or at 10 o'clock tonight, you're gonna remember 20% of it. If you sleep good tonight, tomorrow morning you're gonna remember 80% of it. اسمعي بالزيادة. down with age. So the older you get, the less of the deep sleep. And that's why as a kids you learn a lot. And we said learn three language, تحفظ القرآن, all of this because you have plenty of deep sleep. And deep sleep is where you see, our grandparents used to say العلم في الصغر كالنقش في الحجر. Learning from forget anything you learn as a child. Why? Because it's carved during the deep sleep age. It will go down, 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 down until you, as 9 years old, you will have hardly any deep sleep. And the problem with the deep sleep, as we said, it happened only in the first part of the night. This is the red one is the deep sleep. The red one is the deep sleep, and the blue one is the light sleep. And it happened only in the first few hours of the night. The rest of the night is dream sleep or REM sleep. And that's why if you see all of these heart attack usually and stroke happen in the early morning. If you go to any hospital, most of heart attacks and CVA happen in early morning. Why? Because most of the early morning sleep are dream sleep or REM sleep. Very fast, and the blood pressure will increase, so that put you at risk of stroke. So I always tell my patient, if you wake up at Salat al-Fajr or before, that's why God wants us to wake up at Salat al-Fajr or before, because the rest of the sleep is always REM, and REM sleep is very hard on your heart, so it will put you at risk of having heart attack or stroke. So that's why always try to wake up early and sleep early, so you don't have to spend many time on REM sleep. That's why all of the CVA and the MI happen in the 5 to 7 o'clock hours during day during the morning. So this is REM sleep. REM sleep, I don't need too much of REM sleep. You have higher oxygen consumption, high temperature. The brain is problem in the stage 3 sleep is the one that really benefit from is the one that we consolidate the memory at that time. So this is what we call SCN, suprachiasmatic nucleus. This is part of the hypothalamus. We say the hypothalamus is the one that control our sleep. So this is the part of the hypothalamus here, this green one called SCN, وسائل بيولوجية biological clock. So it's connected with the eye here. So it's carry the light comes from right through the optic nerve to the SCN. When the SCN see the light, it will wake up. It will, the light will start dim the light in the computer, so it will not activate the SCN, because SCN, when you lose the light, it's gonna take 2 or 3 hours before it will, you know, wind down. So that's one of the activities, or one of the solution for the patient who had insomnia. So this is what you call biological clock or suprachiasmatic nucleus, and it's part of the hypothalamus. To London or America where there is not much sunshine, you feel sleepy because light is one of the things that wake us up. And the way our wake up cycle happen is like this. So at 9 o'clock in the morning, look at 9 o'clock in the morning here, there is two drive. God always create things in equal forces. So there is day and night, women and man. And some hormones. Then around 9 o'clock at night, you have decrease in the alerting signal a little bit, and then dark happen, and dark will decrease the sunlight, so you go to bed. So you are programmed to go to bed around 10 to 9, 10 to 11, where you can fall asleep because of the dark, and then you wake up again at night, at the morning time. So this is how things are built by God to make us go on with our daily activities. Coffee, when we drink coffee, coffee will shift the sleep drive, so it will make you a little bit more awake, because the sleep drive is regulated by something called adenosine. Adenosine is what make the sleep drive go. So when you drink coffee, coffee will kick adenosine out of the receptors. So when you drink coffee, it will decrease the sleep drive, so you stay awake. So this is the way Starbucks working, by kicking adenosine, which is controlling the sleep drive out of the receptors. Okay, at night time here, melatonin. Melatonin play a major role in making you go to sleep. Melatonin will not be secreted unless you are in the dark. So there is any tiny little bit of light, it will decrease the melatonin level. That's why you need to sleep in total darkness to get the best out of your sleep. The role of melatonin is to make you sleep better, deeper, and make you kill all the cancer cells. Because when I tell my patient you need to sleep during the night, not after Salat al-Fajr. Why? Because if you sleep after Salat al-Fajr, there is no melatonin secretion. Melatonin will not be secreted unless you get into the night sleep. That's why God probably said, وَجَعَلْنَا اللَّيْلَ لِبَاسًا وَالنَّهَارَ مَعَاشًا. So if you sleep in the light, it will not have any melatonin secretion. And they found out lately that melatonin decrease in women with breast cancer. So this is a good area of research. If you want to do any research, come to our hospital, where we have plenty of breast cancer patient and you ask them about sleep and check their melatonin level, and this will be a great research paper. Some of you will do this. So that's why they said working at night will cause you to have diabetes, heart attack, and cancer. Why? Because when you sleep during the day, you make your cortisol level high, and that put you at risk of diabetes. We said most of the sleep are REM sleep, and that put you at risk of heart attack and cancer because you don't have any melatonin left secreted. So that's why in America, if you want to work night shift, you have to be over 35, less than 35, I'm sorry, and they pay you double the salary usually because, they said if you work at night, you decrease 12 years out of your life. You will knock out 12 years out of your life. That's why you are not allowed to work at night shift unless you are younger than 35. Because younger than 35, you can compensate easily. So the SCN control not only our sleep but our circadian rhythm. So the reason why you are very productive at 9 o'clock in the morning because there's your body is preparing itself. They said is around 2 o'clock. This is where deep sleep happens, restorative sleep, 1 to 2 o'clock. In REM sleep, see in the early morning sharp rise in blood pressure here, where you should be awake. You should not be sleep at 5 o'clock because there will be huge increase in your blood pressure. So you better not be sleeping at that time. Height alertness around 10 o'clock. This is the best lecture I do usually is at 10 o'clock. I hope to do it in the future. Best coordination around 2 o'clock in the afternoon or 3 o'clock. So your body is equipped to handle things according to the time. We are in connection with the circadian rhythm. Melatonin secretion around 9 to 10 o'clock in the dark. And you see here the dreams, why our dreams is very bizarre and illogical. Because during dream time, our limbic system is very active. And the way is bizarre because the limbic system is active, and limbic system we said is illogical. That's why the dream is very bizarre. But during the day, our limbic system is not bizarre. Why? Because the frontal lobe is the one that correct our limbic system. But when we are asleep, the frontal lobe is asleep also. That's why our dream are very bizarre and disorganized. Because during REM sleep, your limbic system is highly active, and you this is where what happened. We said the eye take the light to the retina send the light connection to the SCN. When it sees the light, it will activate the brain. During the dark, the SCN will be inhibited here, inhibition. The penile gland will start secreting melatonin. Melatonin make us sleep deeply, slow our heart rate, and slow our temperature. So this is at night. During the day, uh, daytime, the SCN will be activated. Penile gland will stop secreting serotonin. It will prepare us to go to work and have heart rate increase and temperature increase, so we can run and deal with the stress of life and solve the question of the exam. So this is how the light affect our SCN. The problem now, they said there is a quick link or clear link between uh, Alzheimer and sleep. So people who does not sleep well, they are at risk of developing Alzheimer. Why? Look at this red and green things in the brain here. This is a normal person who sleep well, and this is a guy who is sleep deprived. And when we sleep deprived, we have increase in the tangle and the thing that really cause us to be aggregated in the brain. The tau is the substance that located in the brain and cause us to have Alzheimer. So this is because because sleep deprivation increase cytokines level increase neuroinflammation, and that increase the Alzheimer disease pathology. So in sleep, you remember in sleep where we said the most important part of the brain is called the LPFC, the lateral prefrontal cortex, and this is where it works based of norepinephrine and dopamine. And you notice that norepinephrine and dopamine are very high during the day, because norepinephrine and dopamine is the one that make us alert and awake. So during dark hours is where we make this new cells in the hippocampus, and make you very good in meditation. And we said also, if you remember, the hippocampus where we store information, and we said the hippocampus making new cells around midnight. That's the peak neurogenesis in hippocampus is at midnight. That's why we really need to sleep between 10 and 2. This is the most out of your sleep. This is the one you build the new cells in the hippocampus and make you very good in the dark, because the brain cells does not grow in the light. So during dark hours is where we make these new cells in the hippocampus. It does not happen in the light, or it does happen in the light, but very, very little. So this is what wake the brain up. We said norepinephrine is necessary to wake up, and it's available during the day. Acetylcholine, the one that help us remember things, and histamine that make us alert and awake. This is what we call cortical arousal. This is what make us alert and awake. So if you take an antihistamine, you feel foggy. Why? Your thinking is very foggy because you don't have enough histamine and acetylcholine to make your brain alert and awake. So there is medication, or there is substance that make you sleepy, like GABA, make you sleepy and relax, and there is glutamate that make you alert and awake. So glutamate are early in the morning, too much glutamate; at night, less glutamate. Same thing, norepinephrine, histamine, acetylcholine, all of this make us alert. And orexin, we said orexin increase when we are hungry and when we are in love. That's why you cannot sleep when you are hungry because you have too much orexin, and you don't sleep when you are in love. Because, do you love me? Tell her, look at my orexin level; it's very high. So I'm in love with you because I have enough orexin. So orexin is a substance that increase when we are in love and when we are hungry. And there's medication now to decrease orexin. It's called Belsamra or Survaxant. This is a new sleeping agent that make you sleep at night if you take it, because it decreases your orexin level. So this is the way we said glutamate work. Glutamate is the signal that comes from the eye to the SCN that stimulate the brain, is a glutamate signal. So any medication that decrease glutamate make us sleepy and tired, like valproic acid, the one we use for seizure and bipolar, quetiapine, lithium, carbamazepine, quetiapine, Seroquel, olanzapine. All of this is decreasing glutamate level and make us feel zombie. And as we said, why bipolar patient doesn't like to take medications, because it makes them zombie and tired and sluggish. The best hour to go to sleep in Riyadh is 10:37. Okay, I'm just kidding. This is one of the studies. So sleep is very important, like vital sign in psychiatry. Always I ask patients, how is your sleep? If you are depressed, you have bad quality of sleep, and you feel tired in the morning, that make you more depressed. If you have trouble falling asleep, this is anxiety. If you have trouble staying asleep, it is unipolar depression. Bipolar usually don't sleep at all because they feel sleeping is a waste of time. Because when you are manic, you want to change the world, and you don't have time to sleep because you want to change the world. The problem with the sleep is very important. This is the most important slide in the presentation. Sleep, look at the depressed patient and the normal patient. Normal patient, we said go to stage one, two, three, and back to REM. You go to deep sleep here. This is what you call deep sleep. Depressed patient, if you notice here, don't go to deep sleep. So that's why when you wake up as depressed, you wake up tired as you went to sleep. Why? Because deep sleep is what make you refresh. طيب سؤال أو question, why patient in depression don't go to deep sleep? Remember, when you are in deep sleep, it's very hard for you to wake up because it's deep. Deep means deep. You cannot wake up in deep sleep. Very hard. So when you are depressed, usually you feel threatened. It's like I'm telling you, you're gonna sleep on this couch, but there is a snake and a lion under the couch and a dinosaur out the door. So you're not gonna be able to sleep. Why? Because you're gonna be alert to fight that snake or dinosaur who's gonna come and eat you. And will body will not let you go to deep sleep because there is dangers outside. But what happens if you don't go to deep sleep? We said if you don't go to deep sleep, you become very emotional. Like see the patient in depression here, they go to superficial sleep, then go to REM quickly. So we call short REM latency. That means they go to REM. Usually we don't go to REM sleep until like 90 minutes. But here, when you are depressed, you go to REM sleep very quickly. Within second, you are in REM sleep. So we call that short REM latency. Why we dream a lot? Because we want to solve the problem we're having by dreaming about it. We need to do lectures about this, whole lectures about this. Maybe later on we'll do it. But that's why depressed patients don't go to deep sleep. And what happens if you don't go to deep sleep? We said in deep sleep is where we secrete growth hormone. So if you are depressed, you're not gonna secrete growth hormone. Why? Because you are not going to deep sleep. What happens if you don't secrete growth hormone? You have osteoporosis because growth hormone is what make your bone grow and make your skeleton enough strong. So if you don't go to deep sleep, you're gonna have osteoporosis because lack of growth hormone, and you become emotional and tired and sluggish all the time. If you don't go to REM sleep or deep sleep, you become angry. So anytime you see a patient who are very angry and short temper, ask him how was your sleep because you didn't sleep well last night. If you sleep well last night, you will be calm and relaxed the next morning. So there is plenty of illness that goes with the sleep. One of them is restless leg syndrome, where your legs is moving all the time during sleep. This could be due to anemia, pregnancy, Parkinsonism, and it has a treatment with medication called robironol. Very quarter of a milligram will help with the restless leg syndrome. So they have urge of irresistible urge to move their legs a lot during the night time. So they wake up very tired because it will not let them go to the deep sleep. Very common here in the US and in Saudi because of obesity, is directly related to obesity. So when you go to sleep, the muscle relax. Here, normal sleep. Here, sleep apnea. The muscle relax, the tongue goes down, and because of the fat tissues here, the tongue muscle will obstruct the airways, and you start snoring heavily, and you have sleep apnea. So you have apnea when the tongue goes down when you go to the deep sleep. So that's why sleep apnea patient cannot go to deep sleep because they will die if they go to deep sleep. Because in deep sleep the muscle relax and the tongue will go down and will obstruct the airways, and then you wake up and go to stage one sleep. So most sleep apnea patient go to deep and then stage one, deep and stage one, because they keep shifting. They have fragmented sleep, so they don't sleep very well. They wake up as tired as they want to sleep. So treatment of sleep apnea or symptom is snoring. When you wake up, you wake up with headache, you feel fatigue, poor sleep, agitation. You have congestion. Why you have congestion? Because when uvula and tongue move back and forth all the time, it increase the liquid in the muscles and they make you congested in the morning. You have sexual problem. You have irritability and anger. So this is normal breathing here. This is obstructive breathing, and this is obstructive complete obstruction, where the airways is completely obstructed. And this is where some people might have a stroke or die in their sleep because they cannot breathe and get the oxygen down. So this is the typical patient of sleep apnea. They have very thick neck. Their neck is over 17 and a half inches, very short neck. The tongue goes down at night time because they have a huge tongue and it will obstruct the airways. So it could be due to the fat deposition in the part of the neck. So treatment for sleep apnea is either CPAP machine, we're gonna see addict, or weight loss. Weight loss will help with the sleep apnea. So this is a typical person of sleep apnea. I will let you read it on your own. Now, this is a tricky question, and all of you will answer that the most guy with a sleep apnea is number four, which is not true. Number four doesn't have sleep apnea, although he is the most severely obese person. Number three, the skinny one, is the one who had severe sleep apnea. Why? The weight is not the only factor. Weight is an important factor, but it's not the only factor. Look at the chin here. The obese man had very advanced chin. So there is plenty of room for the airways to go, even if the tongue went down, there is plenty of room in the back for the air to go down. But look at the number three, there his chin is recessive. So any tiny little relaxation will make the tongue obstruct the airways. So this one has no sleep apnea, number four. Number three had severe sleep apnea. So treatment of sleep apnea is called CPAP machine. CPAP machine is make the airways, you put it in your nose, and it will make airways goes. So the tongue wanna move down, but because of the airstream will not make the tongue move down, so it will keep the airways intact during sleep, and you wake up fresh. And most patients, when they use the CPAP machine, they told me we slept for the first time in our life. We have a great sleep because they really have good sleep after that. So treatment is CPAP machine. We said CPAP machine will put an airway pressures, preventing the tongue from obstructing the airways, and making enough room for the air to goes down. Now this is Mona Lisa, and this is Mona Lisa with sleep apnea. See the difference is here. She gain weight, she become very obese and short neck. This is Mona Lisa after she finished the neuroblock exam. She become a little bit different. This is just the joke, okay? There is an illness called sleep paralysis. Sleep paralysis, wake up at night, but you have no movement, but you are alert and you cannot move your body at all. And treatment with exercise will resolve it, and it's easy to treat. There is sleepwalking. Some people will walk during their sleep, and usually happen in under stress or under any problem. I'm gonna stop here because it's 5 o'clock. The rest of that slide, I wanted to read them. Very important to read them, but we don't have time for them. Hopefully, we'll do them in the future. And I'm ready to answer any question now. And if you have any question, please, we'll answer it immediately, inshallah. Any question? I see a lot of questions. I don't know if they can reschedule them or not. We just give you a glimpse of that. If you want, I'm ready. Just call me, and we can do it. Just let Dr. Yaqinuddin call me and reschedule it even after the exam, because you need this for the rest of your life. No, the first two patients in the pictures have sleep apnea, but the tricky is the last two. That's why they put them in the. Yes, the two patients in the pictures have sleep apnea. Psychopaths and sociopath are the same, different name, but the same. It's like milk Nadic and MRI, the same milk. It's very hard to wake up at stage 3, yes, but he can wake up, but he will wake up confused and angry. So, and REM sleep is very hard. Waking up should be around stage 1 and 2. That's why it's very easy to wake up around stage 1 and 2. REM and stage 3 is a little bit difficult. I don't think we're going to ask you from the last of the slides, so don't worry about it. But you really need to know psychiatry, whether you're going to have exam or not, because they are very important. I feel like all of you need to be a good psychiatrist, because as you notice that all of us need psychiatry. So you need it whether you are a physician or an engineer, an eye doctor or GI doctor. You really need to have psychiatrists. It's related to everything. Now, I don't know about the question, guys. I sent Dr. Din about 100 question, and he will choose like 10, 20, 30. I don't know how many he gonna choose out of them. But there is a committee for question and answer. I'm not part of it. So. Jails means prison. And most like anti-prison. So most of the criminal have antisocial personality. Thank you.
Thank you.